Simplified. No, really. I do mean oversimplified. So let's get right to it. What is bone remodeling? What if I told you that there's a whole cellular process set up in your skeletal system to remodel your bones? We're going to mention some terms while we explain, so let's do a quick review to keep everyone in the loop. Long bones have a fairly simple anatomy, so for the purpose of this short presentation, we will concentrate on long bones.
The epiphysis is the end of the bone. It is the place where bone grows in length. It is characterized by soft bone, cancellous bone tissue.
The diathesis is the long cylindrical shaft of the bone. It's made up of compact, hard bone. It has a narrow cavity that contains marrow.
The periosteum is a fibrous sheet surrounding the diaphysis. It contains blood, lymphatic vessels, nerves, and osteoblast.
Wait, osteoblast? What is an osteoblast? How rude of me not to have introduced myself. I am osteoblast, also known as a bone formation cell. And allow me to introduce my sibling, osteoclast.
Please excuse our parents for the confusingly similar names. When parents have 37.2 trillion cells in a body to name, they run out of imagination.
Us and telling us apart. Osteoblast, B for build, and osteoclast, C for crush. But I digress. Let's get back to bone remodeling.
As an osteoblast, I am a bone-destroying cell. I help dissolve bone and its minerals, especially calcium and phosphate. I hang out in the surface of bone and I leave behind small cavities in bone during the process called destruction.
Is a bone-forming cell. I can be found on the surface of the bone too, but I prefer to be right beneath the periosteum. I fill the small cavities. Osteoclast leaves behind a process known as bone formation. Sometimes I get trapped and mixed with other materials, a mixture of collagen and mineral salt crystals. This resulting mature bone cell is called osteocyte.
This process, bone destruction and bone formation, continues throughout life, and bone formation and resorption occur at about the same rate, so that the density of a healthy bone is fairly constant. We do get some help with this process since there are many factors that affect bone remodeling. For example, age, gender, physical activity, nutrition, and even some medications.
In addition to these factors, hormones like parathyroid and calcitonin play a role in bone remodeling. Simply put, when blood calcium levels are low, parathyroid hormone is released to bind to me, osteoclast, to inhibit her We'll pretend that didn't happen. We know this is an amateur. So, simply put, when blood calcium levels are low, parathyroid hormone is released to bind to osteoblast, to me, to inhibit my activity, thus indirectly stimulating osteoclast to release calcium, causing blood calcium level to increase. And when calcium levels are high, calcitonin is released to bind the osteoclast to inhibit her activity, thus causing blood calcium levels to decrease.
And there you have it, as promised, a very simplified explanation of bone remodeling. So next time you're giving a massage, remember that massage therapy impacts every system of the body, even the cellular level.
As you learn more as a student of massage therapy, you will gain a superb understanding about the benefits of massage therapy for the treatment of a number of conditions that affect the skeletal system.
Happy reading and happy learning.
Here's to massage therapists facilitating healing and one massage at a time. Together we are working on keeping bones healthy.